This is Chapter 8. We are going to be covering the joints of the human body. So in this chapter, we are going to be looking at the various types of joints in the body. We're going to be looking at classification of joints and looking at the different movements that can be carried out by joints. So first, just looking at the definition of a joint. So a joint is a point of contact between two or more bones. Could be also between cartilage and bone, or also between teeth and bone. So structurally, joints are going to be classified based on their anatomical characteristics, and functionally, they are classified based on the type of movement they permit. So we really can look at two different types of classification based on their structure or based on their function. So the structural classification of joints is based on two criteria. The first one is going to be the presence or absence of a space between the articulating bones. This is called a synovial cavity. So the first criteria we look at is there a synovial cavity or not? Is there that space between the articulating bones or no? The second criteria we're going to look at for structural classification is the type of connective tissue that binds these bones together. So synovial cavity and the type of connective tissue. So there are three types of structurally classified joints. The first one is fibrous joints. This is where there is no synovial cavity, and the bones are held together by dense, irregular connective tissue that's really rich in collagen fibers. Okay, so here we're going to have no synovial cavity, bones are held together by dense, irregular connective tissue, and really rich in collagen fibers. Then next we have the cartilaginous joints. With these also have no synovial cavity, and the bones are held together by cartilage. And then the last structurally classified joint is going to be synovial joints. So synovial joints are joints in which the bones forming the joint have a synovial cavity. So there is a synovial cavity in these. And the bones are united by dense, irregular connective tissue of an articular capsule. So these will have a capsule surrounding them. Articular capsule. And often there are a lot of accessory ligaments as well. Now, on the other hand, functional classification of joints relates to the degree of movement that they permit. So they are classified as one of three types. First is the synarthroses. This is an immovable joint, so it cannot move at all. There is no movement allowed. Next type of joint is an amphiarthrosis. This is a slightly movable joint, so just a little bit of movement is allowed. And the third functional classification of a joint is diarthrosis. So this is a very freely movable joint. Think like your hip joint or your shoulder joint. Freely movable. One other thing of note is that all diarthroses are synovial joints. Diarthroses have a variety of shapes, and they permit several different types of movements. So all joints are going to have both a structural and a functional classification. So first we will be talking about fibrous joints. Just like I stated, these lack a synovial cavity, so they have no synovial cavity. And the articulating bones are held very closely together by a dense, irregular connective tissue. Now there are three types of fibrous joints, and these are sutures, syndesmoses, and interosseous membranes. Now remember, fibrous joints are going to allow very little, but most permit no movement. So first off, we have a suture here. So a suture, this is going to be a fibrous joint composed of a very thin layer of dense irregular connective tissue. Now, sutures only occur between the bones of the skull. The irregular and interlocking edges of sutures give them added strength and also decrease their chance of fracturing. So we can see this kind of zigzag irregular pattern here. In older individuals, sutures are going to be immovable, so they are synarthroses. These are in older individuals. But in infants and children, sutures are going to be slightly movable, so they are going to be classified as amphiarthroses. Sutures really play important roles in shock absorption in the skull. Now, some sutures, although present during the growth of the skull, are replaced by bones in adults. Now, these types of sutures that are replaced by bones in the adults are called synostosis. So these are sutures replaced by bone. So that they're no longer that dense, irregular connective tissue. Now, this is also known as a bony joint. Now, not all sutures become synostoses. These are just a couple of them that become these bony joints. And a bony joint is a joint in where there is complete fusion of two separate bones into one. For example, the frontal bone grows in two halves, so it kind of grows in like a line down the middle here, kind of grows in two different halves, and they join together across a suture line. Now, usually they're completely fused by about age 6, and the suture actually becomes obscure, so you can't really see it anymore. Now, a synostosis is classified as a synarthrosis because it is immovable. On this right picture here, we can see kind of a big close-up at a suture where we do get a little bit of slight movement. Again, these are going to be in infants and children, and where we have that slight movement with a ligament, for example, at a suture, we're going to call these amphiarthroses. A syndesmosis is a fibrous joint where there is a greater distance between the articulating surfaces and more dense irregular connective tissue than in a suture. Now, the dense irregular connective tissue is typically arranged in a bundle that we call a ligament, and this allows the joint to permit limited movement. One example of a syndesmosis is the distal tibiofibular joint. Now, this is where the anterior tibiofibular ligament connects the tibia and the fibula. Now, this ligament permits slight movement, so it is classified as an amphiarthrosis. Now, another example of a syndesmosis is called a gomphosis. This is also called a dentoalveolar joint, and this is where a cone-shaped peg fits into a socket. Now, the only examples of gomphoses in the human body are going to be articulations between the roots of teeth and their sockets. Now, these are going to be found in the maxillae, or the upper jaw, and the mandible, or the lower jaw. Now, the dense irregular connective tissue between a tooth and its socket is the very thin periodontal ligament. This is a membrane here. And a very healthy gomphosis permits no movement. So it would also be classified, or it would be classified itself as a synarthrosis. Allowing for no movement. Now, the final category of fibrous joints, the third category, we'll just kind of add it on this page because we have a good example here, but the third category of fibrous joints is the interosseous membrane. Now, this is a very substantial sheet of dense irregular connective tissue that binds neighboring long bones and permits slight movement. So it's going to be classified as an amphiarthrosis. Now, there are two principal interosseous membrane joints in the human body. One occurs between the radius and the ulna in the forearm, and the other occurs between the tibia and fibula in the leg. So we can actually see it right here. Cartilaginous joints, like fibrous joints, they are also going to lack a synovial cavity, and they allow very little to no movement. Here, the articulating bones are very tightly connected by either hyaline cartilage or fibrocartilage. Or fibrocartilage. Now, the two types of cartilaginous joints are the synchondroses and the symphyses. Okay, we have the synchondrosis here. This is a cartilaginous joint in which the connecting material is hyaline cartilage. Now, an example of this type of joint is the epiphyseal or growth plates between the epiphysis and the diaphysis of growing bones. Now, functionally, a synchondrosis is an immovable joint, so it would be classified functionally as a synarthrosis. Now, when bone elongation finishes, when you stop growing, bone replaces the hyaline cartilage, and then the synchondrosis becomes a synostosis, a bony joint. Next, we have a symphysis. Now, this is a cartilaginous joint in which the ends of the articulating bones are not covered with hyaline cartilage, but a broad, flat disc of fibrocartilage connects the bones. So here we have fibrocartilage. Now, all symphyses occur in the midline of the body. So the midline of the body. So the pubic symphysis here, or symphysis, this is between the anterior surfaces of the hip bones. This is one example of a symphysis. Now, this type of joint is also found at the junction of the manubrium and the body of the sternum, and also at the intervertebral joints between the bodies of the vertebrae. Now, a symphysis is a slightly movable joint, so it is classified as an amphiarthrosis. Then we have synovial joints. Now, synovial joints have certain characteristics that distinguish it from other joints. The unique characteristic of a synovial joint is the presence of a space called a synovial cavity, also known as a joint cavity, between the articulating bones. Now, because the synovial cavity allows considerable movement at a joint, all synovial joints are classified functionally as very freely movable. So functionally, they are classified as diarthroses. The bones at synovial joints are covered by a layer of hyaline cartilage. That's called articular cartilage. And the cartilage covers the articulating surfaces of bones with a really smooth, slippery surface, but it does not bind them together. The articular cartilage works to reduce friction between the bones in the joint during movement, and it also helps to absorb shock. So here we can see the structure of a typical synovial joint. A sleeve-like articular capsule, also known as a joint capsule, is going to surround the synovial joint. It encloses the synovial cavity here. And the articular capsule also unites the articulating bones. So we have one articulating bone up here in the top and the second articulating bone down here. Now, the articular capsule is composed of two layers. We have an outer fibrous membrane layer and an inner synovial membrane. So this one's going to be the outer layer, and this is the inner layer. So the fibrous membrane, this usually consists of dense irregular connective tissue, mostly collagen fibers, that attaches to the periosteum of the articulating bones. Now, the fibers of some fibrous membranes are arranged as parallel bundles of dense regular connective tissue that are really highly adapted for resisting strains. Now, the strength of these fiber bundles, called ligaments, are really hold together this joint really well. It's really the principal mechanical factor that holds bones close together in a synovial joint. The synovial membrane secretes synovial fluid. Synovial fluid is a viscous, clear or pale yellow fluid. It's really named for its similarity in appearance and consistency to an uncooked egg white. Now, this fluid forms a thin film over the surfaces within the articular capsule. Now, the synovial fluid does have some really important functions in the synovial joint. Its functions include reducing friction by lubricating the joint, also works to absorb shock, and it also does a lot of supplying oxygen and nutrients, as well as removing carbon dioxide and metabolic waste from the chondrocytes within the articular cartilage. So remove CO2 and waste from those chondrocytes. Now, many synovial joints also contain accessory ligaments. Now, these are called extracapsular ligaments and intracapsular ligaments. So, extracapsular ligaments, these are going to lie outside the articular capsule. Examples are going to be the fibular and tibial collateral ligaments of the knee joint, which we will look at a bit later. And then the intracapsular ligaments. These occur within the articular synovial membrane. Examples are the anterior and posterior cruciate ligaments of the knee joint. The various movements of the body create friction between moving parts. So we have these sac-like structures called bursae. Now, these are going to be strategically situated to alleviate friction in some joints, such as the shoulder and the knee joints. Bursae are not strictly part of the synovial joints, but they do resemble joint capsules because their walls consist of an outer fibrous membrane of thin, dense connective tissue that's also lined by a synovial membrane. Now, structures called tendon sheaths will also reduce friction at joints. Now, tendon sheaths, these are also sometimes called synovial sheaths. These are a specific type of bursae. These are a tube-like bursae. And they will wrap around certain tendons that experience considerable friction as they pass through tunnels formed by connective tissue and bone. Now let's discuss some specific movements at synovial joints. Now these movements at synovial joints are grouped into four main categories. So the first movement category is gliding. Second category is angular movement. Third is rotation. And then fourth is special movements. Now, special movements will only occur at very certain joints, but we will discuss that yet. So the first one here that we have on this page are the gliding movements. So gliding is a really simple movement in which these nearly flat bone surfaces will move back and forth and from side to side with respect to one another. There's not really any significant alteration of the angle between the bones or anything like that. Gliding movements are really limited in range due to the structure of the articular capsule as well as the associated ligaments and bones. So here we can see with the carpals in the hand and wrist, we have some very slight gliding movements, but they're going to be very restricted just because of the shape of the bones and the articular capsules around those bones and joints. On this page, we have angular movements. So in angular movements, there's an increase or decrease in angle between the articulating bones. The major angular movements are going to be flexion and extension, lateral flexion, hyperextension, and then the other ones that we will see later are abduction, adduction, and circumduction. So first one here we have flexion and extension. These are going to be opposite movements. So in flexion, we can see here, flexion, there's going to be a decrease in the angle between the articulating bones. So decrease in angle between the articulating bones. So we have a bone here and a bone here, and so we're going to be decreasing that angle between those bones. That is going to be flexion. Now on the other hand, we have extension. This is going to be the opposite movement. In extension, there is an increase in the angle between the articulating bones. So extension is an increase in the angle. Oops, there we go. Increase in angle between those articulating bones. So we're going to kind of have this bone and then this bone. So this angle is going to be much larger than this angle. Now both of these movements usually occur along the sagittal plane. We can also see flexion and extension at the atlanto-occipital joints. Also flexion and extension at the hip joint and knee joint. Now, even though flexion and extension usually occur along the sagittal plane, there are a few exceptions. For example, flexion of the thumb involves movement of the thumb medially across the palm at the carpometacarpal joints. So like when you touch your thumb to the opposite side of the palm, that's going to be flexion of the thumb, but it doesn't occur in the sagittal plane. Now, another example is movement of the trunk sideways to the right or left of the waist, like here. Now, this movement occurs along the frontal plane, and it involves those intervertebral joints, and we call this lateral flexion. Now, continuation of extension beyond the anatomical position is called hyperextension. So that's beyond anatomical position here. So on this page here, we have abduction and adduction. So first off, we have abduction, AB, means away. This is going to be the movement of a bone away from the midline. Then on the other hand, adduction, adduction, this is going to be movement of the bone toward the midline. So spelled A-D-D-U-C-T-I-O-N. It's toward the midline. Now, both of these movements usually occur along the frontal plane. The movement that returns each of these body parts to the anatomical position is going to be adduction. Adduction will always return body parts to their anatomical position. Now, the midline is used for reference for, say, your arms and your legs. So we have abduction and adduction at the shoulder joint, abduction and adduction at the hip joint. But the midline of the body is not used as a point of reference for abduction and adduction of the digits. So here we can see movement at the metacarpal phalangeal joints of the fingers here. And in abduction of the fingers, but not the thumb, we kind of have this imaginary line drawn through the longitudinal axis of the middle finger. So kind of, well, not really straight line, but kind of a line down this way. As the fingers move out from the middle finger, this is called abduction. So they kind of move, or they spread out from the middle finger. And then in adduction, they come together toward that middle finger. Here we have circumduction. Now, circumduction is movement of the distal end of a body part in a circle. So important note is going to be distal end of body parts. Now, circumduction is not an isolated movement by itself, but rather it's a continuous sequence of flexion, adduction, extension, abduction, and rotation of the joint, or in the opposite order. So it's kind of this movement in a continuous circle, but really it's flexion, which is followed by abduction, followed by extension, followed by adduction and rotation. So I'll rewrite that a bit better. Rotation. So yeah, circumduction is really just a continuous sequence of the other movements that we've talked about prior. In rotation, a bone revolves around its own longitudinal axis. One example is turning your head from side to side at the atlantoaxial joint, like when you shake your head no. In the limbs, rotation is defined relative to the midline, and very specific qualifying terms are used. So if the anterior surface of a bone of the limb is turned toward the midline, the movement is called medial rotation. So we can see here with the arm being turned toward the midline, the anterior surface of the arm being turned towards the midline. This is medial rotation. And same, the anterior surface of the leg being moved at the hip joint toward the midline, being called medial rotation. So you can medially rotate the humerus at the shoulder joint by starting in anatomical position and then flexing your elbow, and then moving your palm across your chest. And then to medially rotate the femur at the hip joint, you can lie on your back, bend your knee, and then rotate your leg and foot laterally. This one isn't shown here, but this is where the femur is rotating medially. Now, if the anterior surface of a bone or limb is turned away from the midline, the movement is called lateral rotation. So we can see our arm turning away from the midline here at the shoulder joint, being a lateral rotation, and same with the foot and leg being turned away from the midline at the hip joint, being lateral rotation. Now, special movements only occur at certain joints. These are going to include elevation, depression, protraction, retraction, inversion, eversion, dorsiflexion, plantar flexion, supination, pronation, and opposition. So very briefly, we will go over each of these. So first off, elevation. This is a superior movement of the body, such as closing the mouth at the temporomandibular joints. So remember, this is the joint between the mandible and the temporal bone. So elevation in this case is going to elevate the mandible. Shrugging the shoulders is also going to be an elevation special movement. So shrugging the shoulders at the acromioclavicular joint to elevate the scapula and clavicle. Then the opposing movement to elevation is depression. So depression is an inferior movement of a part of the body, such as opening the mouth. So this is movement in the superior movement, and this is inferior movement. Okay, next we have protraction. Protraction is a movement of the part of the body anteriorly in the transverse plane. So anterior movement here. So you can protract your mandible at the temporomandibular joint, like here. And this is by thrusting it outward. The opposing movement to protraction is retraction. And retraction is a movement of a protracted part of the body back to anatomical position. Next, we have inversion. This is a movement of the sole medially at the intertarsal joints. Its opposing movement is eversion. Eversion is movement of the sole laterally at the intertarsal joints. So this is a medial movement and this is a lateral movement. Dorsiflexion. This refers to the bending of the foot and the ankle, at the ankle joint. Remember, this is also the talocrural joint in the direction of the dorsum. So dorsiflexion occurs when you stand on your heels. And its opposing movement is plantar flexion. So plantar flexion involves bending of the foot at the ankle joint in the direction of the plantar or inferior surface. So this is like when you elevate your body by standing on your toes. Next we have supination. This is a movement of the forearm at the proximal and distal radial ulnar joints. And this is where the palm is turned anteriorly. Now this position of the palm is going to be one of the defining features of anatomical position. So its opposing movement is pronation. So pronation is movement of the forearm at the proximal and distal radial ulnar joints, in which the distal end of the radius crosses over the distal end of the ulna. This is where the palm is turned posteriorly. Lastly, we have opposition. This is a movement of the thumb at the carpometacarpal joint, and this is where the thumb moves across the palm to touch the tips of the fingers on the same hand. Here we have a summary table of all the movements at synovial joints. Here we have gliding, the angular movements, rotation, and special movements. So these are all movements that we've gone over in the past couple slides, but just a nice table summarizing all of them. Although all synovial joints have many characteristics in common, the shapes of the articulating surfaces vary. So synovial joints are actually divided into 6 different categories, and this is based on the type of movement. So these are going to be the structural classifications of synovial joints. So these are plane joints, hinge joints, pivot, condyloid, saddle, and ball and socket. So here we have the summary table of all of them, and we will go into each in a little bit detail in the following slides.